Hello, my name is Lars Bullinger. I'm the head of the Department of Hematology, Oncology and Tumor Immunology at the Charité Universitätsmedizin in Berlin. And I'm happy to talk to you today about my personal highlights on MRD, measurable residual disease diagnostics in acute myeloid leukemia from this year's ASH meeting. And I would love to talk to you about two studies that were presented. One was focusing on molecular predictors and effectiveness of measurable residual disease eradication with chemotherapy and allogeneic stem cell transplantation in acute myeloid leukemia, which was presented by Dr. Stahl from New York. And they were looking at measurable residual disease as a prognostic marker in AML and wanted to see whether the elimination of MRD prior to an allogeneic transplant would impact outcome. And what they could demonstrate is that patients that following induction therapy are still MRD positive when they convert into MRD negativity prior to stem cell outcome, that they have a more favorable prognosis. Of course, this was unfortunately not a randomized study. I think in the future we will really have to test whether it's really the MRD negativity that impacts outcome or whether this is only reflecting patients with a more favorable disease because they still respond to initial consolidation therapy prior to transplant. But nevertheless, it pointed out the relevance of MRD negativity or underlines the relevance of MRD negativity prior to allogeneic transplant. And then the second study I wanted to mention was on NPM1 as a molecular marker for measurable residual disease. This was a study presented by Dr. Tiong from Melbourne in Australia. And here the goal was to characterize the course of the copy numbers for the molecular persistence of NPM1 following induction chemotherapy, and they could show that patients that convert into MRD negativity or have a very good response also have a much better outcome. There is some patients that might stay like slightly MRD positive, but then will convert into negativity, and they also have a favorable prognosis. But approximately half of the patient will then later relapse, and therefore the conclusion of those of the authors was that we really should more tightly monitor NPM1 in these cases to be able to predict a relapse more early. In addition to those two studies, there were many others that also focused on new technologies. And here I wanted to mention new developments in next generation sequencing technology that now also, for example, allows us to detect FLT3 internal tandem duplications at a high accuracy. This was a very interesting talk or presentation by one of my former colleagues from the University of Ulm, by Julia Herzig, and I think this is also worth being mentioned. And I think these were the now three, not only two highlights from this year's ASH. I think we will hear more about MRD measurement in the future. It will become more and more important, especially as we have more targeted therapies available. Thank you very much.